Hi everyone, my name is Dr. Anup Bharani. I'm a physician in the palliative care department here in the Mount Sinai Health System.
And hi, I'm Rabbi Edith Meyerson. I'm a chaplain with the palliative care team in the Department of Geriatrics and Palliative Medicine at Mount Sinai.
Hello, my name is Carla Alves-Miraldo. I'm the senior clinical nurse at the Palliative Care Center.
We are here to answer the top 8 most asked questions about palliative care. So, Carla, what's the first question?
And the first question is, what is palliative care, guys?
That's a good question.
Edie, you want to start us off?
Sure, I'll tackle this one. Why not? Palliative care is specialized medical care for people living with serious illness. This type of care is focused on providing relief from the symptoms and stress of that illness. The goal is to improve quality of life for both the patient and their people, their family, and their loved ones.
We are a large team here at Mount Sinai, and we're made up of doctors, nurses, social workers, chaplains, integrative therapists who are working really closely together to make sure, alongside the patient's other doctors and team members, to make sure that we're adding an extra layer of support for those patients and their families. Palliative care is based on the needs of patients and not on a patient's prognosis, so we can provide services at any age, any stage of someone's illness experience.
I also want to add that with palliative care, it really helps you understand your illness on a deeper level. It gives you confidence to take control of your healthcare decisions. With palliative care, you can feel empowered to choose path A or path B, knowing that you have options and you don't have to go through with any specific treatment if you don't feel like it's the right one for you.
Yeah, I think that it's making sure that who someone is and what their values are, it's really making sure that the treatments that are being offered are really in alignment with who somebody is and what their values are.
I'm happy to take to the next question to reveal. So
And
we'll
what do we
see.
have?
Top 2 survey says, what is palliative care versus hospice?
Oh, that's a good
Who wants to
one.
start
That's a
with
good
that one?
I'll take it.
Okay.
While both focus on relieving symptoms and improving the quality of life associated with serious illness, palliative care can be utilized at any time during the illness. Hospice, on the other hand, is in fact a Medicare benefit that only applies to terminal illness, and one must forego curative treatment or life-sustaining therapies.
Can be really confusing, and so sometimes the way that I like to explain it is palliative care is sort of the umbrella term under which there's a lot of different things that we do. Hospice is a really small subset under that, that's for a specific population, but palliative care can be provided to a lot of different folks experiencing a lot of different health concerns, and we can help support them by adding that extra layer of support.
All hospice is palliative care, but not all palliative care is hospice.
Yeah, all right, so do you want to take the next one?
I'm ready.
All right,
ready.
go
I'm ready.
for it.
Okay, here we go. Carla, are you ready?
I'm ready.
Are you ready? Okay.
Drum roll, please.
Whoop.
Oh, is palliative care bad?
I don't know. Is it?
Of course not.
Oh, say more.
There are misconceptions about palliative care because it's relatively a new field. The goal of palliative care is to improve your quality of life in the setting of a serious illness. And the way that palliative care does that is by 1, relieving your symptoms and distress, 2, helping you better understand your disease and diagnosis, 3, helping clarify your treatment goals and options, 4, understanding and supporting your ability to cope with your illness, and finally, assisting you with making medical decisions. And I have to say that palliative care is a beautiful gift for patients.
So I think why people think that palliative care might be a bad word is that it can be charged. It can bring up a lot for folks in thinking about taking care of themselves within a serious illness and what their quality of life might be. And I think, it's really fortunate that we get to work alongside a lot of different folks who get to tackle that from many different angles and alongside their providers for their serious illness to make sure that we are, addressing any misconceptions to make sure that they understand what we're there to do and how we can help them alongside their other treatments that they might be receiving.
Guys, I haven't read a question yet. I'm gonna take this one.
All right.
Here we go. See if I can read upside down. Do I give up curative treatment when I receive palliative care? I don't know, do I?
Oh no, Edie. Your treatment choices are up to you. You can have palliative care at the same time as treatment meant to cure you. In fact, some studies show greater benefits when palliative care and curative treatments occur together. I saw you reading upside down. You did a great job.
Oh, thanks.
I don't think I can.
Totally fair.
All right. Okay. Do I give up my doctors when I receive palliative care?
I don't know, let's ask the doctor.
Thank you. No. In fact, you don't give up your doctors when you meet us in palliative care. We are there to provide an extra layer of support to patients and families alongside and in partnership with your other doctors and other providers, generally speaking.
So what do we have next?
Okay, so I guess we will see. Can I get palliative care at home? That's a really good question. So you absolutely can receive palliative care at home. You can receive palliative care in many different settings. Palliative care at home can add an added layer of support for patients and families living with serious illness, their caregivers, their healthcare teams, quite frankly, as they're navigating serious illness. Palliative care at home arranges for coordinated care with physicians, there's nurse practitioners, there's nurses, social workers who can come into the home to help patients and families navigate what they're going through. And at Mount Sinai Health System, we actually do have palliative care in a variety of settings, including the hospital, clinic, or outpatient-based setting, and at home. So we can meet you where you're at and what makes the most sense for you and your family.
Does the care change depending on the setting?
Yeah, it's a good question. And so the truth is that you have some of the same providers across settings, which is really a wonderful thing here at Mount Sinai. So folks that you might see in a home might also see you in the hospital. And so the same disciplines, the same folks that you get to know really well across the spectrum of your illness will continue to follow you in different care settings. So the approach to the care, the type of things we're going to ask you about, the type of things we're going to focus on remain largely the same across different settings.
That makes for really great continuity.
Can I relieve you of this board?
Please, it's getting so heavy.
Now, Carla, would you like to do the honors?
Sure.
Our next question,
Question
number
is-
7.
How does palliative care help me choose the best treatment options?
We spend time talking and listening to you and your family. We will make sure you completely understand all of your treatment options and choices, as complicated as they can be.
Yeah, if I can add,
Yeah, please.
one thing, I think, our job a lot of the time is we know the healthcare system, we know some of the topics in and around healthcare, but you know yourself the best. So you and your family, the people that are important to you in your life, get that information from us, and we want to try to match that with who you are, learning about you, your values, your goals. And so it's really important that we get to meet you where you're at and match our recommendations to what you're trying to achieve. When someone has a serious illness, it's important to recognize all parts of who they are, not just whatever's going on medically. And so I feel really lucky to work alongside you all who are helping us tend to those needs. We've seen a lot of really exciting things happen in palliative care in terms of honoring people, the things that are important to them, the people that are important to them, the celebrations that are important to them, making sure that we're caring of all parts of them. And so I don't know if folks want to add anything to what you've seen kind of in your time overall.
Yeah, I think that one of the things to hold up is that when someone is affected by serious illness, the timing is always inconvenient, and yet we have plans. We're human, and we want to be able to celebrate life events. We want to be able to be with our people. We want to be able to feel connected with who we are and who's important to us. We even had a graduation on the unit many years ago.
Flowers and music. We go above and beyond. Will insurance cover palliative care? Most insurance plans, including Medicare and Medicaid, cover palliative care, just as with other hospital and medical services. If costs concern you, our social workers can help you find payment options.
All right, I think we answered all the questions, right?
I think we did. Hopefully we answered yours.
Yeah, thanks for tuning in, and hope we answered all the questions about palliative care.
Perfect. We want to see it. Yep. And that's a wrap.
That's a wrap.
All right.
Bravo.
Thank you.